Thank you all for joining us today. We are excited to share the results of the National HIV Criminalization Survey report with you today. I am Tammy Haught, co-managing director of the Sero Project. Just to stay up front, the webinar is being recorded. The recording and slides, along with any links shared in the chat box, will be shared later on and sent out to everyone who registered for the webinar. We do ask that you please place your questions in the question and answer box so they don't get lost in the chat box. Questions will be answered at the end of the presentation. And if you'd please introduce yourself in the chat box with your name, pronouns, and where you're from. We would love to see where you are coming from. Next slide, please. So today we also want to make sure that we recognize that it is National Women and Girls HIV/AIDS Awareness Day. Sero recognizes the impact of HIV criminalization on women and girls throughout our country, especially those who are most impacted, the Black, Indigenous, and women living with and women of color, trans women, sex workers, and the intersections of these members of our community. Your resilience is remarkable, and your stories are inspiring and important. Now I have the pleasure to introduce and turn the webinar over to Tara McKay. Dr. Tara McKay is a sociologist and assistant professor of medicine, health, and society at Vanderbilt University. She is an associate director of the Vanderbilt LGBTQ+ Policy Lab and a member of the Tennessee Center for AIDS Research. Dr. McKay has over 15 years of experience researching HIV and LGBTQ health and has collaborated with the Henny Group on multiple survey and evaluation projects in the US on the health and well-being of people living with HIV. So let's all welcome Tara.
Thank you so much, Tammy. It's such a pleasure to be here today and discuss the results of this national survey that we conducted in 2021 on HIV criminalization. And I'd like to acknowledge the funding and support that we received for this project from the Health Not Prisons Collective, Gilead as well. And this was a collaboration with the Sero Project, the Henny Group, myself working with Henny Group to really do this broad national survey to assess attitudes, perceptions, experiences of laws criminalizing HIV transmission, perceived or actual. So to get started, I want to give folks a little bit of an introduction on the ways that people living with HIV are criminalized in the United States. There are 3 different kinds of laws that we can think about. And these laws apply in a situation where a person living with HIV is typically accused of not disclosing their HIV status and or of perceived potential or actual exposure or transmission of HIV. And importantly for each of these, actual transmission of HIV is not necessary for prosecution in most states. So what kinds of laws are there? 25 states have HIV-specific laws. A majority of these laws criminalize non-disclosure of HIV positive status or potential transmission of HIV to sexual or injection drug use partners. Some of these laws also criminalize non-disclosure or potential transmission in other circumstances where the likelihood of transmission is low or zero, including things like donating blood, spitting, or biting. And these laws can be used to prosecute people living with HIV, whether or not the virus is actually transmitted in that exposure event. Most states without these kinds of specific laws might still prosecute people living with HIV under a general criminal code, or they might also have sentence enhancements for other crimes that apply to people living with HIV. For example, we've seen cases where an individual is accused of biting, spitting, or urinating on a corrections officer. These can also be applied to extend the length of sentences for prostitution or solicitation of sex by a sex worker who's living with HIV, who hasn't disclosed their status, regardless of whether they or not they use condoms during a sexual encounter. and other crimes that are alleged to be committed by people living with HIV. And again, these charges can be brought regardless of whether the virus is actually transmitted in that event. And many of these statutes impose potentially severe penalties, including very long prison sentences or even life imprisonment. Very few states, as you can see on our map, have no specific law or have not prosecuted people living with HIV under any other statute. So back in 2012, the Sero Project did an initial survey looking at people's experiences of these laws. And I wanted to kind of recount some of their initial findings from 2012 to get a sense of where things are the same, where things are different. A lot's changed since 2012, but what we were thinking about in 2012 was really thinking about how people were experiencing these laws. What was the mental health burden here? What were the fears of prosecution related to HIV status? Kind of what were the impacts of these fears on people's behaviors, on their likelihood of disclosing their HIV status to sexual partners, to injection drug use partners, to healthcare professionals and others. And so in 2012, they found that this fear of prosecution related to HIV status generated a lot of concerns about testing and accessing care for HIV. In particular, 1 in 4 participants reported knowing at least one person who did not get an HIV test because of fears of prosecution. So people were avoiding HIV testing because they were concerned about being criminalized. More than half of respondents felt that avoidance of HIV testing was actually a reasonable choice given the situation. And the presence of HIV criminalization laws were largely unimportant to individuals' decisions about whether or not they disclosed to a partner. So the laws weren't having their stated intended effect. That was to motivate disclosure. People weren't behaving in the way that the laws were created to actually generate. So they also found that people living with HIV received very vague information on how to protect themselves from prosecution. And they reported a lot of fear of false accusations of transmission, exposure, or non-disclosure in this context. And then finally, respondents held little trust in the judicial system for like the outcome that they might get a fair hearing. There's very little trust that this would actually occur. So in 2020, our purpose was to look at, again, some of the things that have changed, some of the things that were different. Some of the laws have changed in several states. Treatment access is different, and the transmission dynamics have also changed in that 9-year period. So we were interested in thinking about and understanding the views and experiences of people living with HIV on their experiences of these laws, criminalizing HIV transmission, exposure, and non-disclosure of HIV status. Some of the key findings, in case you drop off, are that, again, we find that people are very aware of these laws. People living in states with HIV-specific criminalization laws are more likely to have heard of someone getting arrested, to personally know anyone, including themselves, who had been accused, threatened, or arrested on an HIV-related charge. That is to say, these laws aren't background, they are people's lived experience. They are things that people must engage with in their everyday life and that they're paying attention to. People living with HIV in our sample also report that it's more difficult to disclose their HIV status in the context of these laws to both sexual and substance use partners. This has implications also for their communication with healthcare providers, we find. And then additionally, we find that HIV criminalization laws are associated with decreased trust in public health. So kind of the broad umbrella of what public health is doing and why they're doing, as well as very specific behaviors like COVID-19 vaccine uptake. So we show that in people living in states with HIV criminalization laws have decreased trust and have lower uptake of the COVID-19 vaccination. So some kind of big idea concepts in terms of public health trust, as well as very specific, very current behaviors that are affected by this distrust. Overall, excuse me, we also find that respondents have strong support for the repeal and modernization of these laws, and that much like 2012, people felt it was reasonable to avoid things like HIV testing and treatment for fear of being prosecuted. That's our overview of some of our findings going forward. So what do we do in 2021? We created a survey, an online survey, and recruited folks through multiple community organizations. Thank you if you're on the call and participated in this. We really had a broad reach and tried to engage a lot of different organizations. So we recruited folks who were adults 18 and older from community organizations from August 18th, 2021 to December 31st, 2021. So basically the end of 2021. And we had over 1,000 individuals actually engage with the link and engage with the content. About 900 actually started our survey and got some part of the way through, and 624 completed the full survey. And I'll be talking about today about the folks who completed the full survey. Some of the things that I'll be presenting to you today are just kinds of descriptive statistics. So kind of the frequency or percentages, the average responses on certain questions. And then I'll also talk a little bit about where we've tested for group differences and show you when those differences are meaningful. And I'll look at larger analyses that actually control for some demographic characteristics as well as US Census region. And I'll let you know when each of those kinds of things are happening. Let me tell you a little bit about the sample that we did pull. So our sample demographics actually in terms of region and state nicely reflect the distribution of people living with HIV in the US, which is much larger in the South, but that proportion is much larger in the South. So in 2019, Southern states accounted for approximately 46% of all people living with an HIV diagnosis, and we recruited about 52% of our sample from Southern US states. 20% from Western states, 15% from Midwestern states, and about 11 to 12% from Northeast states. We also are fairly well distributed across sexual orientation, race, ethnicity, and gender in this sample. So 56% of our sample identified as gay or lesbian, 27% as straight or heterosexual, 9% as bisexual, and 9% as something else that didn't include these categories. 51% of the sample is white, 32% of the sample is African American, 9% multiracial, and 8% was Latino or Hispanic. The sample includes about 2/3 cisgender men, 27% cisgender women, and about 5% transgender or non-binary individuals. In terms of partner status, a little over half of the sample is single, and 41% are married or partnered. The HIV diagnosis year is also fairly well distributed and matching our ideas of diagnosis year in the prevalence of HIV in the United States, with 40% with a diagnosis year between 1982 and 1996, 28% between 1997 and 2007, and 32% from 2008 onwards. Our sample is largely in kind of midlife, with 32% in the 30 to 49 age range, and 49% in that 50 to 64 age range. We do have some older adults over age 65, 15%, and fewer younger adults 18 to 29, that's 4% in our sample. A little bit about some of them. So 52% had no experience working or volunteering in an HIV-related organization, either full or part-time, leaving the other 48% to be employed in some way or having volunteer experience in HIV-related organization. Some of those folks are self-employed, some of those folks are employed in government HIV programs, some of them are employed in HIV healthcare or nonprofits, or providing volunteer services. Across our sample, we also asked to kind of get a sense of different kinds of life experiences. And so we asked two questions. One was, have you ever been a person who fits any of these categories? And so we can show you folks who currently identify with each of these categories, as well as folks who identify with these categories in the past. And so overall, we see that a lot of our sample has experience identifying as a person who uses drugs deemed illegal, some sex work experience, Many experienced homelessness or being underhoused. Many engaged in survival sex or were survivors of domestic violence, and many received public assistance benefits. Additionally, and an interesting fact about our sample, I mentioned previously that about 40% of respondents reported being married or partnered, and 2/3 of those who have a partner also reported being in a serodiscordant relationship. So I think this really kind of is driving home the need for continued services and attention to the HIV criminalization laws, how they're applied in relationships, and thinking about how partners navigate some of this. In terms of people's exposure to laws, about more than half of our sample lived in a state with an HIV specific law, and about 45% did not. And among those who lived in a state with no HIV specific law, which was about 278 people, 67% lived in a state with sentence enhancements related to HIV. And so we had very few individuals who lived in a state that had none of these kinds of laws, no exposure to any of these laws. 1/3 lived in a state that had prosecuted people living with HIV under other general criminal statutes. And importantly, these things affect people's experience. And so if we compare people living in a state with HIV specific criminalization laws to those who live in a state with no specific criminalization law, we find that people living in states with these laws are more likely to personally know someone, including themselves, who's been accused, threatened, or arrested on an HIV-related charge. They're also more likely to have heard of anyone in the state being arrested for non-disclosure of HIV status to a sexual partner. So again, these laws become people's lived experience through their networks and through their exposure to the laws themselves. Importantly, many of the people living with HIV in our sample think that their state criminalized HIV and/or transmission and/or exposure, even when it didn't. So 75% of people living with HIV in states with an HIV-specific criminalization law correctly identified that their state has such a law. And 61% of people living in a state with no law also thought that they lived in a state that had one. And so there is some concern here that folks are perceiving that these laws exist everywhere, even when they don't live in a state that has that law. This might be due also to the varied legal environment and as well as more recent changes in repeals and modernization that have happened in some of these laws, and the ability of states to bring these charges without a specific law. So even if you don't live in a state with a specific law, you might also face charges due to general application of other laws. About 1 in 5 respondents reported being told that they could be prosecuted for not disclosing their HIV status when they received their HIV positive test result. So to flip that, 4 in 5 of our respondents were not told when they received their HIV positive test result that they could be prosecuted. Respondents who were told were more likely to be transgender or non-binary compared to cisgender men. They were more likely to also already work in the or volunteer in the HIV field. They were more likely to live in a state with an HIV specific law, and they were more likely to have been diagnosed after 2008 compared with 1982 to 1997. So more recent diagnoses were more likely to be coupled with this information. So what does living in this environment kind of do for folks? It creates a lot of mental health burden, especially around fear of false accusations. So we find that roughly 40% of all of our respondents reported that they had been afraid of being falsely accused of not disclosing their HIV status. And many, I'm showing you the image here, many actually worried about this frequently or at least a few times. Respondents who reported personally knowing someone who had been accused, threatened, or arrested on an HIV-related charge were more than 2 times more likely to worry about this. So to the extent that this is happening in your extended network, or you hear of someone that has this experience, you're much more likely to worry about it for yourself. And you can see in the graph here that there's also variation in people's identities in terms of how much that worry is happening. And so you see overall that about, excuse me, 38% of our sample is worried about this at least frequently or a few times. But this is much larger for transgender and non-binary folks who might be subject to these laws more often. And still, and also larger for cisgender men compared to everyone in the sample. We also break this down by people's experiences. So the experiences of having ever experienced serious HIV-related discrimination, for example, or ever worked in sex work or engaged in survival sex. These are experiences that increase the likelihood that someone might worry about having charges being brought against them for their HIV positive status, or the likelihood that they've been threatened. We also see this happen for survivors of domestic violence, as well as people who have ever used drugs deemed illegal, people who were ever homeless or underhoused, or received public assistance benefits. So each of these categories is reporting more elevated worry relative to our full sample that doesn't include those. Additionally, people were very unsure that they would actually receive a fair hearing if they were accused. So if they were charged and proceeded to criminal hearings, there was a lot of concern that the hearing they would receive would not be fair. And this is actually unchanged from 2012, slightly increased, but not substantially different, but so really unchanged. People continue to have this worry that they would not receive a fair hearing if they were accused of failing to disclose their HIV status. Well over half, right, are very sure that they would not or probably not receive a fair hearing. Some of those expectations of receiving an unfair hearing in terms of why people are thinking that they would receive an unfair hearing are largely due to their identity categories. So we asked them, what were some of these reasons that you think you might not receive a fair hearing? And they stated, because of my HIV status, because of my sexual orientation, because of my race, ethnicity, because of my gender, because I'm transgender, or because of my immigration status. And the groups that our participants perceived to be most disproportionately targeted by HIV criminalization laws were African Americans living with HIV, men who have sex with men living with HIV, sex workers living with HIV, so our top 3, but also transgender women living with HIV, sex workers living with HIV, so on. In the context of these laws, we are really interested in how it might affect trust in public health. And so we asked several questions about how these laws might impact different behaviors like disclosure, like discussions with healthcare providers, and even just kind of global perceptions of what public health is doing and how well it's doing that job with these laws. And so you're looking at a graph here that asks whether laws that criminalize HIV non-disclosure, exposure, and/or transmission undermine public health efforts. And this was a yes, no, not sure question. So overall, participants strongly agreed here and said yes, that these laws are undermining public health efforts. And the agreement here was even stronger among some of the categories that we know are more disproportionately targeted by these laws, such as those who are engaged in sex work or survival sex, those who've also experienced other serious HIV-related discrimination elsewhere in their lives, who've been homeless or underhoused, used drugs deemed illegal, or are survivors of domestic violence. Additionally, we show that people living with HIV who viewed public health professionals as caring more about enforcing laws that criminalize HIV transmission than about their health were more than 6 times more likely to limit what they tell their healthcare providers. So we asked folks to kind of agree, disagree on a question of whether public health professionals care more about enforcing laws than my health. And folks who say yes to that question, who strongly agree to that question, are much more likely to limit what they tell healthcare providers. We also see in a really direct application of that distrust in public health that people living in states with HIV-specific criminalization laws are significantly less likely to be fully vaccinated for COVID-19. So by a few percentage points here. And so not only do we see that the total number of people who've actually gotten and completed their COVID-19 vaccination by the end of 2021 is lower when people living with HIV live in states that criminalize HIV. But we also see that folks were slower to get even to a first dose. So even when they were going to complete their COVID-19 vaccination, they were slower to get to that point to get their first dose. And we see lower overall completion in those states with HIV criminalization laws. And these are in fully controlled analysis. So we control for other aspects of individuals' demographic characteristics and the region that they're living in. We also find that people living in states that had HIV criminalization laws were significantly less likely to have received the first shot of their 2-dose vaccine. All right. One thing that the laws were kind of talked about as intended to do was to encourage people to disclose their HIV status to sexual partners and injection drug use partners and health workers. Several studies have shown that this just doesn't happen. And again, we have found here that when we actually look at community norms, we find that people very often already are disclosing. And so you can see in the lighter colored bar, folks who agree that most people in my community are open about their HIV positive status with sexual partners. While there is some variation, the disagree bar tends to be the minority here. And when we asked people why they thought this was the case, respondents frequently identified other moral and ethical reasons for disclosure of HIV status, like it's the right thing to do, this is what I want to do, this is how people should behave. And they rarely, almost never, cited the laws criminalizing HIV non-disclosure, exposure, or transmission as actually encouraging them to disclose their HIV status to their substance use or sexual partners. Importantly, we see this pretty consistently across whether or not states have or do not have a law. So the law isn't really increasing this disclosure or creating this community norm, which is what you see in the first few bands when we look at all participants. We see states with an HIV criminalization law, about 28% agree that most people in my community are open about their HIV positive status with sexual partners. And in states with no specific law, we see that that's 26%. Where we do see some differences is in minority communities, so African American and Latino communities. In these communities, people living with HIV are more likely lost my train of thought. Black and Latino Hispanic people living with HIV are more likely to live in communities that have higher rates of police and criminal legal system contact. And when this happens, excuse me, we see that actually those laws decrease some of that disclosure. So we see higher rates of a disagreement in these contexts. HIV criminalization laws also, participants reported, made it more difficult to disclose their HIV positive status to sexual partners. So overall, we asked participants to rate whether laws that criminalize HIV transmission, perceived exposure, or non-disclosure made it more difficult to disclose to sexual partners. make me feel like I'm under constant surveillance, make it harder for me to establish open and honest relationships. And so we see some evidence of harms here. 3 out of 4 respondents, about 73%, also agreed that laws criminalizing HIV non-disclosure, exposure, and transmission made it harder for AIDS service organizations to have open and honest discussions with clients or members that were living with HIV about sexual behavior and disclosure of HIV status. So we also see these impacts carrying forward to folks trying to do that prevention work. Finally, we see that folks have very strong support for repeal and modernization of these laws. Over 80% of people living with HIV felt that these HIV criminalization laws should be revised and modernized or repealed. Right? There was very strong support for these outcomes. And support for repeal is consistently high across all demographic groups, state policy environments, and geographic regions. We find no differences across these different kinds of cuts in terms of the support. Everybody supports modernizing and or repeal. And when we asked folks why they supported these things, they reported that laws criminalizing HIV were unnecessary, harmful, inconsistent with the science, and not the best public health solution. Finally, to highlight a couple findings for National Women's and Girls HIV Awareness Day, we'd like to identify that transgender and cisgender women both identified as groups that were identified by participants as groups that were disproportionately targeted by HIV criminalization laws, and that these laws continue to create a substantial mental health burden among women. And so have the figure here for the amount of worry that transgender women and cisgender women are experiencing related to whether or not someone's going to bring charges against them based on their HIV positive status. And that's almost 2 in 3 transgender women that we surveyed, and 1 in 3 cisgender women reporting that this is a frequent or at least somewhat common occurrence, that I'm worried about someone bringing charges against me based on my HIV positive status. To give you a little bit of an overview of our findings here, again, people living with HIV in a state with HIV criminalization laws were more likely to have heard of anyone in the state being arrested, personally know anyone who had been accused, threatened, or arrested on an HIV-related charge. Many were very concerned about being falsely accused of not disclosing their HIV positive status. And there was a lot of distrust that these laws would be applied fairly or justly. The impacts of these laws and that mental health burden is that people limit information sharing with healthcare providers, that it's more difficult to disclose HIV positive status to sexual partners and substance use partners. It's harder for AIDS service organizations to conduct open work on HIV disclosure in the context of these laws. And people reported increased distrust of public health programs, which we actually see manifested in lower uptake of COVID-19 vaccination, a big public health campaign happening at this time of our survey. People also limited disclosure in minority communities that were already disproportionately targeted by police and the criminal legal system. So these laws, combined with over-policing, really had a negative detrimental effect on disclosure in these communities. And then finally, an overwhelming amount of our participants felt that HIV criminalization laws should be revised and modernized or repealed. I'd like to thank our amazing community partners who participated and shared information about the survey, helped us gather responses. If you have additional questions about the survey, about some of the findings, please feel free to email Tammy Hott. Her email is here. If you would like a copy of the report, go ahead and grab that QR code. These slides will also be made available so you can that you can find that again, and that'll be available on the Sero Project's website. Tammy, I have one more slide for you.
All right, thank you, Tara. And then we also just wanted to let people know who the next Road to HINAC 5 webinar will be, what to expect. And the registration link is there. It's going to be April 10th. at 6:30 p.m. Eastern time. Thank you, Tara, so much for this overview and the conclusions that you got through the survey. There are a couple of questions in the question and answer box. We did say that we asked people to put the questions in, but I will offer up at this time, if people wanted to raise their hand and ask the question yourself, please raise your hand and I can get you to come off mute. Otherwise, I can read the questions, whichever people prefer. But I wanted to give people an opportunity to ask the question on their own as well. Seeing no hands, I will go ahead and read them. Said Texas has HIV criminalization laws or not. So Texas is a state that was one of the first states to repeal their HIV specific law. However, just found out Representative Venton Jones from Texas, a man living with HIV, was elected to the legislature this last year. So he has introduced a bill to clean up all of the other criminalization laws that impact people living with HIV. He has it introduced. I don't know what the bill number is, but if you go on to Sero's website and under our bill tracker, it is on the map of the bills that we are watching. So you can see what bills that he is addressing through his legislation.
Amazing.
Yeah, he's an amazing guy. Then the next question, and I'm not sure when this was asked, the question was, where do you stand in this scenario? So and maybe that was with the question that continued. A person is living with HIV, knows the concept of detectable, undetectable, and is on treatment, but still detectable, is advised to tell the partners by the HIV consultant, but decides to not share the diagnosis with the partner, has multiple sex encounters with others without protection, and transmit HIV to the partner. What can be done? So, Tara, I don't know if you want to answer that or if you want me to.
Yeah, I think I study the laws from a zoomed out context rather than the if this then this application context. I mean, I think we've looked at in a lot of across our research that at least criminalizing the non-disclosure piece doesn't help people do this better, which is what I think I can take away from that. In terms of how we respond to that question.
I agree with that. And I think the survey and also the 2012 survey also showed that these laws are not good public health policies. So what can be done if somebody is in this scenario? One, law enforcement and prosecutors have multiple avenues of if criminalization is warranted to use, that there's just no reason to have HIV specific laws. And that's one reason why the majority of people who filled out this survey said that these laws need to be repealed or enforced. I just personally feel that criminalization is never the answer for public health response, but there's always civil avenues if somebody feels that they have been harmed. But these criminal laws in the long run do not help people living with HIV, and they're obviously they have a negative impact on public health efforts.
I would add that it's also not how they're very often applied, right? I'm in Tennessee. In the Tennessee context, they are almost always applied in the context of like vice soliciting sex from a sex worker who they know is HIV positive, who then is criminalized for soliciting sex as an HIV positive person. And so, we have multiple examples of this from Memphis, which is the bulk of our criminalization cases in Tennessee. And so while I think we have these kinds of conversations about what if this and then this and then this, it's really just not how they're applied. They're applied to target really specific folks in really specific circumstances, often and very usually where transmission never happened or is unlikely to zero probability to begin with, right? So we also had a case recently in Nashville where a homeless person spat on a police officer and was then charged, for example. And so we know that is a zero transmission probability event that this person was then, held in jail for an extended period because they used a sentencing enhancement to add on to resisting arrest, for example. That makes sense.
Thank you. Yes, absolutely, Tara. Thank you. And Donna, I see that you had your hand raised, so you can unmute.
Can you hear me okay?
Yes, we can.
Great. I'm sorry I'm not on. I'm on my phone. And I don't know if Kamaria is on, but this came up during the summit in Orlando in late January. It was and I'm just bringing it up. It isn't necessarily, I don't think it'll be part of what you surveyed, but it was something that was research focused and thinking about sending it to our Florida consortium on HIV research. The question that came up, and I don't know if we have the data on it, and I was wondering if Kamaria was on, because I hope I'm saying it right, is how many people being incarcerated on some of these laws, especially the antiquated laws in Florida, have actually transmitted HIV. And I don't know if there's any research on that or how to even get research or find out that level of research. So I just wanted to bring that up because it was of interest at the summit.
I think that's a great question. I have seen a few resources. I don't have that number on the tip of my tongue, but tracking cases is actually very challenging because there's no central reporting on this. And so the organizations that have been able to do this do it with a Freedom of Information Act request and then try to put these things together. And so there was a report, the one I'm most familiar with is the one on Tennessee, but where they were looking at those cases and trying to see and tracking them and trying to see what the outcomes of the criminal charges were in terms of pleas, in terms of guilt finding in a hearing situation, and what the sentence length was to be able to show the application of these. And I think their finding was that transmission happened in very few of these cases.
That's kind of what we thought, but thank you.
Yeah.
And if you ever find, or if you could find states or places that have done that, if you could share, that would be awesome in the future.
Great.
And I also see that Nathan Cisneros is on this webinar, and we know that the Williams Institute has done several reports. So I guess I would ask Nathan if you have any information or on that you could share, or maybe he had to jump off. Let me see if I can find him.
It's exactly that one that I'm thinking of, because they did
there
the
he is.
Tennessee one. Yeah.
All right, Nathan.
Hi.
Hello. Not to put you on the spot, Nathan.
No, I'm happy to talk about the subject. Unfortunately, we have very little information, as other speakers have mentioned. In Memphis, for example, and this was with our co-author Robin, who's at the University of Memphis, we got a hold of arrest records, so police statements, a little bit of the investigations. For the most part, health status is censored in these public records requests. Reading between the lines, it seemed like very, very few. So, we didn't include it in the report because we couldn't definitively say one way or another. It looked like very, very few of those criminal exposure cases alleged even the possibility of transmission, let alone actual transmission. I will say that we have another set of documents in Indiana where we might be able to get a little bit more detail on that. And I don't want to speak too soon, but it seems like, again, in Indiana, cases in which there's an allegation of actual transmission are incredibly, incredibly rare. But we should have that information out later on in the year.
Thank you so much, Nathan. And then I did see that you had a question in the question and answer. Did you want to go ahead and ask?
Yeah, sorry, not to hog the spotlight. I was curious among survey respondents, what proportion said that they had actual contact with either law enforcement or the criminal system because of HIV-related allegations, and then also if you had any measures of mental health outcomes between those two groups.
Yeah, I was just trying to pull up what we have, and I don't see it right away. But we do, I think, have questions on that exposure and that experience beyond just the perception or the worry about it. We do have, did you experience criminal charges, for example, as an outcome? And I don't want to guess on the number here on live on camera. But it is something that we have in the report and in the data. Yeah.
Thank you. And thank you, Nathan. Darren, see you had your hand raised.
Hello, everyone. This was a great webinar, and thank you so much for allowing me to be on here. Thank you, Tammy. Hey, Kamara. Hey, everybody. Eric, I see all you guys. I was wondering, as you look at the report, because it's of course, this is a great webinar. This is a great resource and tool, and I'm excited to share this information. I have organization that I partner with here in Alabama, and they asked me to do something on the 1st on HIV criminalization. So I'm excited to get these slides. But I was wondering, because this is such a great resource and tool, I think it's also a great learning opportunity for those who may be living with HIV to also, because I had the question, like, did the research include a question where you ask how did they disclose, if and when they disclose, meaning did they have their partner sign a consent? Did they go to the doctor with them? Because I think that's an important piece for those living with HIV, also to guide them in, and protecting, of course, themselves and protecting their partner. And because we know that sometimes you have retaliatory situations. So I think if you had any information about that, that would be helpful. And what type of, if you asked that question, what were the types of disclosures that you saw? That's the question. Thank you.
Yeah, that's a great question. We don't have it in that level of detail in terms of how people are disclosing. We were able and interested in getting at what kinds of situations people do disclose in, and don't have that level of detail of like how do you start the conversation, or do you go to the doctor with them, or those kinds of things. And I think that would be really important information to have as well. One of the reasons we might be a little have some limitations here in terms of what we're able to ask is we were really trying to keep this really short so people would complete it on their phone in a context, with COVID and all of our competing things that were competing for our time and energy and life force during the pandemic. And so we're really trying to keep that pretty concise and don't have that level of detail. But I agree, other research should certainly pick up that level of detail on those questions so that people can get an idea of what strategies people are using. Is informal disclosure, is that what's happening? Are people assuming people are aware when they're, share the same network or environment, but maybe don't ever have a direct conversation, for example? I think those are all great questions.
Yes. And thank you, Tara, and thank you, Darren, for that question. I think we captured all the questions in the Q&A box and chat box, but if anyone else has any additional questions, if you want to raise your hand or put it in there. And if not, I want to thank you all for joining us. And Eric, thank you for putting in Sero's Linktree link into the chat box where you can find all things that Sero has coming up in the future. But just want to give everyone just a minute to raise their hand. Oh, here, Robin.
Yes, hi. I was wondering, in the report, did they ask about whether or not a person identified as a sex worker? I was wondering if any of the responses were by people that were identified as sex workers or IV drug users, that we got their opinion of those different questions.
Yes, absolutely. So we have, let's see, over 50% of the sample identifies as someone who now or in the past, a smaller percentage or a larger percentage in the past than now, but 12% now and 44% in the past identify as a person who used drugs deemed illegal. And then we have about 17% of the sample identified as either now or in the past as a sex worker.
Thank you.
You bet.
Great question. Thank you, Robin. Not seeing anyone else who has raised their hand. I want to thank Tara for and the Henny Group as a whole for partnering with us and doing this research, and also to Gilead for funding the project so that we can have this information. Thank you all for joining us today. I hope you have a great weekend, and we will be sending out all the information like we said earlier. So have a great afternoon.
Wonderful. Thank you, Tammy.
Thank you.